So, ladies and gentlemen, I got about 10 or 15 minutes to talk. On my way here, I was just thinking, what am I going to say? So, the first thing is, Amarjit has called us, we are Bapio. What is Bapio doing with what Bapio has to do with Ayurveda? We are all practitioners of allopathic medicine. So, the first thing I will have to just explain why we are here. The second thing is, my understanding of Ayurveda, what actually is Ayurveda? And my daughter is teaching me a few things about this. So I will just mention a few things. I will mention the difference between the issues of allopathic medicine versus Ayurveda. And then what are the ways we can have some sort of integration. Baroness, Right Honorable Baroness Swarmaji, it was really pleasure to hear what you were saying. And disruption, you said disruption. I think that's a very important word. Without disruption, things don't move. And one big disruption, I think, that's happening now is the change in the government. And I have noticed that the Labour government, was it yesterday or day before yesterday, Prime Minister said, we want consultation and major consultation from everyone. Now, we, of course, are going to be part of the consultation, but the problem is the politicians who have the capacity to ensure that the outcome of the consultation is followed. So we will look forward to the disruption from you to ensure that this Labour government does what it should be doing. Anyway, so why Bapio? You see, Bapio is British. Now we named this organization as British because we live in this country, we are British, and we didn't want to be seen as outsiders, telling Britishers what to do. So we start as British. But we are Association of Physicians of Indian origin. And the reason we have ensured that we put Indian word in that is because we have pride in our background, in our culture. There are lots of good things. Of course, there are a lot of good things in British culture, but that's where the integration comes in. You take the best from each other. So, why Bapio should be collaborating about Ayurvedic medicine? You see, I was brought up in India. When I was a child, if I wasn't well, I had cold cough, my mother would make turmeric milk and give me that, and I get better. And I remember that. I remember that as a child, I had a toothpaste with neem in that. Neem, you will understand. And you see the things like that, simple things, was keeping me healthy. And I think I'm still healthy at 77 now. So I understand the importance of simple things which are part of Ayurvedic medicine. So that is one part. Why Bapio is here, because we understand, and I think Amarjit did say that almost 40% of 300 odd thousand doctors working in the NHS are of Indian subcontinental origin. And we all, so that includes Pakistan, Bangladesh, along with India and so on. We all have background in Ayurvedic medicine. So being Indian origin, we have interest in what used to happen during ancient times. And Rajiv keeps on telling me about, he reminds me about ancient medicine. The second thing is, we know NHS is in dire trouble at the moment. And Baroness has mentioned funding, resources. There is no money. I mean, when I came here 40 years ago, the NHS was so beautiful, so nice. But now, and I'm very happy. I say I'm a happy man because I'm retired, so I don't have the hassles the NHS doctors are facing at the moment. And I and Bapio believes that integration and holistic medicine would solve many, many problems that NHS has at the moment. So what I know about Ayurvedic medicine, well, I understand that Ayur is life and Veda is knowledge or science. So it's a science of life. It's not just, or as I understand, it's not just ordinary medical branch. It's a branch which looks after holistic thing. And holistic, this is not holistic. So, Baroness, you mentioned Ramayana and Mahabharata. And I was just thinking that there was no allopathy that time, 5,000 years ago. But there were Hanuman and Bhima and all those huge people. So would they not be ill at times? And how did they get cured? So there must be something in the ancient system of Ayurveda. Now I also
Sanjeevani for Hanuman, Sanjeevani to revive Lakshman at that time from plant.
So there you are. So but now it may be something in writing. I mean, we are not sure whether it's the real thing that happened or somebody wrote it up. Anyway. But the point is that during ancient days, there was no allopathy, which came only maybe a few hundred years ago. So how people were getting cured and how, as Baroness said, people used the herbal and plants and medicine coming out of those. We also know, and Raju has said in his article, that a lot of new allopathic medicines are derived from the plants of experience of the plants from those days. So Ayurvedic medicine, so I've been asked to talk about holistic, and I was Googling what is holistic medicine in Ayurveda, and apparently Ayurveda is the most ancient and the oldest system of holistic medicine. Anushka is looking at me. The reason I'm saying Anushka is because she's fifth year medical student and she has done 1 year in Ayurvedic medicine as a time out. So you must have learned this in your history. So most holistic, and this is slightly the difference between allopathic medicine and Ayurvedic medicine, because allopathic medicine treats the disease when it happens. It treats the symptoms when they happen. So if you have headache, you take paracetamol. If you have infection, you take antibiotic and so on. Ayurveda is different because it doesn't just treat the disease. It's not just the physical, but the mental and the spirit. So that's the holistic system, which is very different. And it's not easy even for me to understand the details of Ayurveda, how Ayurveda can integrate with allopathy. So this is the complication. So what I've got here is now few opportunities that Ayurvedic medicine has in the NHS, because that's what we are hoping to talk today. So the first thing is holistic, and this is, I think, easiest, holistic approach to mental health. Mental health is a huge, big problem in the NHS at the moment. It's amazing how many people are. You don't have to be psychopathic or psychopath to have mental illness. It's the simple thing: stress, depression, tiredness. All those things. A lot of it has to do with mental illness and Ayurvedic medicine. And Sunil is going to talk about something similar. Is much easier approach, easier solution. So Ayurveda can offer non-pharmacological solution to mental illness. The second, preventive healthcare and wellness. So Ayurveda places strong emphasis on lifestyle and diet to prevent disease. And if we can encourage people to understand that, it will be much easier to prevent. If we prevent something, and I think the theme of this conference is prevention is the best, absolutely. Pain management and palliative care. Now, palliative care, these are the people who are dying. But death with dignity is so important. And, all the medicines or the allopathic things available are things like opium, you give opium to people to relieve pain. There's so many better things that could be done without medicine in Ayurveda. So palliative care, complementary therapies for women's health. And I was surprised when my doctor was telling me about how so many things could be done about women's problems for periods, menorrhagia, and so on, all those things, pregnancy, childbirth. There are a lot of things which could assist much easier without using hormones as it is done. And I also understand that there are, at the moment, and I was surprised to learn that there are examples of Ayurveda-related services already in the UK. Amarji did tell me that there are about, you said 600 or 500 Ayurveda practitioners in UK at the moment. So of course, this is private practice and so on, but it is there. So private clinics are there. Also, some of them, and I think some of our audience here probably do have connections with general practitioners in primary care, where they assist with Ayurvedic approach to some of the diseases. But easier, and what is happening is complementary approach. Now, few things which are much easier to do, like advising patients to do the yoga or meditation or massage. And this comes along with acupuncture, chirotherapy, and all that is called part of integrated system. And some of the hospitals and GPs do assist with that, as I understand. However, the direct integration of Ayurvedic treatment into NHS clinical practice is limited due to lack of widespread regulatory framework. Now, this is the issue. But in addition to regulatory problems, clinical evidence and established training. So, Baroness, you mentioned the Western mindset that everything in the West is the best and everything in the East probably not as good. And that's a myth. We know that's a myth. We know the evidence that we have from ancient times, how good things were, although things then deteriorated. Also, I think there is a problem in India, and I'm glad that there are a lot of very senior people who have come from India to talk about it, and I look forward to listening to you. But, in India, there are so many quack Ayurvedic practitioners and also allopathic practitioners. Now, that brings bad name to the system. And we will hear from you what is being done about it. But that also is media. You mentioned how the impact of media goes. And here people see all that in the media about the quack system there. And they think, okay, at least we have allopathy, which is helpful to us in emergency. So the challenges for integrating, how many minutes I got? I got last 2 minutes now. So the first thing we need to do, and I know this is not easy, lack of robust clinical evidence. This is what the regulators in UK will want, the General Medical Council and so on. Now, I understand the difference between the allopathic approach and the Ayurvedic approach is in allopathy, if there is infection, you use antibiotic, who whatever, you give penicillin or amoxicillin. In Ayurveda, it is individual person. So you have to have individual approach to the patient. You can't generalize. Now, if you can't generalize, then if you want double-blind trial or things like that, it is very difficult to get it done for the Ayurvedic system, as I understand. So, but we will hear from you. Regulatory and safety concerns, cultural and educational barriers. So this is another thing. We mentioned about cultural issues that people in the West will not very easily accept this ancient system of medicine and so on without evidence. But also culture amongst the workforce in the National Health Service. At the moment, there are 1.5 million people are employed in the National Health Service. Starts from the cleaner, sweeper to the consultants and then all the managers and so on. So all these people to understand that Ayurvedic system of medicine can be useful in the NHS is not easy to change their mindset. So the education, and you mentioned it in Paradise, that educating people is very important. And how do we educate? So we need to go in the media, we need resources. All these pharma companies, they will not do that. Pharma companies will try and stop us moving to, because then it will be their loss. But there are some other companies which are producing vitamins and all that sort of thing. Probably they might go. But, we can't stop things because of resources. If we want to do something, if we want to go ahead, and Amarjit, I know, is fully dedicated, all his life is promoting. And you said excellence in healthcare. So we need to promote the media as well. So we already talked about resources and cost control. So pathways for integration, finally, research and clinical trials. Hopefully, I'm glad that my team is here. Rajiv, Sunil, Payal, Anushka, all those people are very keen on promoting Ayurveda and see how we can work with the team that has come from India and find ways to produce evidence. So that's one. Second is complementary therapy program. Now, I think this is important, Baroness and Amarjit. This, I think, very crucial for our promotion. The general population of people of Indian origin living in UK is, I think, around 10%. So this more than million people, they would be interested in Ayurvedic. So I know many people are waiting for their hip transplant and knee replacement and all that. Suffering with pain. If the NHS said that, look here, you have a choice. If you're waiting for 1 year or 2 years or whatever, but if you want to use the Ayurvedic system of medicine, then we have some clinics in Ayurvedic medicine. So I think a lot of people of Indian origin in this country would be very keen to utilize that offer. So that's patient choice. Complementary therapy, I think, is already being promoted, but we can promote it more. I know the yoga, as I understand, which is promoted in general, is not the same yoga which is promoted in Ayurveda, because it has to be individually recommended. However, it is doing something. So yoga and other alternative things which doesn't need prescription can be promoted. And then finally, collaborative model. So that is why we are here, to do the collaborative model. And on behalf of BAPIO, I can say that all these doctors of Indian origin I'm talking on their behalf, although everybody may not be there, but I'm talking on their behalf that we will be very keen to support integrative medicine. We'll see how we can support in research, how we can support in media promoting alternative or holistic, we call it holistic medicine. You see, these words are easier digested by Westerners rather than we saying, oh, we promote Ayurvedic medicine. But holistic is Ayurvedic medicine as well. And I was looking at the dictionary this morning, the meaning of holistic medicine. And it says acupuncture, it says chiropractic and all that. There is no mention of Ayurveda there. This is Oxford Dictionary. So we need to see that, look here, where did this acupuncture come from? Where is this yoga and all those things come from? They are all from ancient Indian medicine called Ayurveda. So with that one, thank you very much. I hope the whole day goes very well. And tomorrow goes well. I look forward to nice lunch as well. Thank you.